Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. The most recent Breastfeeding Report Card from the Centers for Disease Control and Prevention shows that the majority of newborns, 83%, receive breast milk at birth. And by 6 months of age, more than half of infants, 56%, are still receiving some breast milk. Joining me to talk about breastfeeding is nurse Cathy Narcavage-Bradley. She has a doctorate in nursing practice, and she's a clinical outpatient health educator at Upstate who specializes in breastfeeding and lactation support. Welcome back to The Informed Patient, Ms. Narcavage-Bradley.
Thank you, Amber.
Compared with previous decades, are more new moms opting to breastfeed these days?
Well, we are seeing more moms choosing to breastfeed in current and recent decades. If you look back to the 1970s and early 1980s, breastfeeding initiation rates in the US were as low as 25%. So most infants were fed formula, and few parents attempted to breastfeed. So very different from the numbers that you shared. We steadily saw increasing rates and are now seeing really much higher rates of breastfeeding initiation during current decades, in part due to the widely recognized public health importance of breastfeeding for both mom and baby.
So, what factors influence whether a mom will breastfeed?
Research shows really that parents' intention to breastfeed is a strong predictor of both starting and continuing on with breastfeeding. And that intention tends to be shaped by the support they receive. And that support can come from family, community, workplaces, and healthcare providers, as well as if they've had positive past or negative past experiences with breastfeeding. Ongoing support and parents' confidence in their ability to breastfeed also plays a major role in sustaining breastfeeding. Some families, especially those facing more economic challenges, health issues during pregnancy, maybe younger age or multiples, or having limited access to healthcare in general, may be less likely to plan to breastfeed at all. And it's really important to recognize that about 5% or so of moms are physically unable to breastfeed, while others choose not to breastfeed altogether for various reasons.
Well, you mentioned the public health campaigns to tell people about the benefits of breastfeeding for
Yeah.
the baby and for the mom. So let's go over those. What are the benefits of breastfeeding for the baby?
For the baby, breastfeeding or human milk feeding, as we call it, also can boost their immune system, which is underdeveloped, in the early days and at birth. It also can help decrease their risk of infections because of that boosting of their immune system. So it reduces their risk of ear infections, respiratory infections. Also, it can decrease the risk of childhood obesity, type 1 and type 2 diabetes. Um, Sudden infant death syndrome, it decreases the risk of SIDS. And so lots of important benefits, and the list does go on, and more we learn about every day.
Now, what about for the mom?
So for moms, the breastfeeding can decrease their long-term risk of breast and ovarian cancers, cardiovascular disease such as hypertension, type 2 diabetes, and osteoporosis. And then also right after birth, so that initial postpartum period, when a mom breastfeeds, they release a hormone called oxytocin, which helps to promote just physical recovery. So it helps that uterus clamp down after birth. That helps control her bleeding. It also contributes and helps for that bonding, calmness, and connection with their new baby with that hormone oxytocin.
So that's good to know. Now, the CDC data says that 83% of newborns receive some breast milk. It goes further to say that only 63% are exclusively breastfed. So the rest are either supplemented with formula or receive only formula. So, can you explain the difference between human breast milk and baby formula?
Sure. So human milk is a dynamic fluid that changes over time with each baby's individual needs, growth, and even their environment. So it includes hormones, growth factors, and enzymes. It also contains those antibodies I talked about, antimicrobial factors, also anti-inflammatory and immune factors, and living cells that help protect babies from disease, and it contributes to their immune system development, as I already mentioned. And then, so if you can imagine, like we're in the cold and flu season entering in at this point in time. After an exposure to a virus, the mom can actually pass on those protective antibodies and make them for their infant to pass on those protective health immunity to help decrease their infection or make the infection less severe. And then compared to formula. So formula is a manufactured nutrition source, which stays the same over time. So it doesn't change based on each feeding or each bottle. And it provides formulated vitamins, minerals to help support infants grow and develop. It's an alternative, and it does help babies, plenty of babies grow.
Well, I didn't realize that about breast milk. So the breast milk that a baby gets day one after birth is different than the breast milk perhaps they'll be receiving within a month or 2 months later. It changes with the baby as the baby grows.
Absolutely. It sure does.
Do babies have a preference, just taste-wise, between breast milk and formula?
I mean, babies, they adapt to what they're provided, so they learn to, prefer what they're doing. But there are studies that do show newborns may prefer the taste and smell of their own mother's milk from an early age. And really, human milk is the easiest food for babies to digest. It's catered to them, and it varies in flavor from those foods that moms do eat.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with nurse Cathy Narcavage-Bradley about breastfeeding and lactation support. What is the optimal number of months for babies to be breastfed?
So, according to many health organizations and the CDC, the American Academy of Pediatrics, um, they all recommend, in order to provide the most benefits to mom and baby, is exclusive breastfeeding for the first 6 months of life, with continued breastfeeding along with complementary foods thereafter for as long as is mutually desired by the mom and baby, which is up to 2 years or beyond to maximize those health benefits, is what is recommended.
So some babies go directly from breast milk onto solid foods without formula in between?
Yes. So some babies do go on to solid foods from breast milk without adding formula in there. But it's important to keep in mind families choose different feeding paths, and there's really no single right path or approach for each family. Babies who are exclusively breastfed don't necessarily need formula, and breast milk can remain their main milk source, continuing with solid foods. Sometimes formula may be recommended due to medical reasons, such as insufficient milk supply or excessive weight loss. And some parents choose formula from the start or choose to transition to it after breastfeeding for even a short period of time. And really, any amount of breastfeeding is beneficial, and families are encouraged to make informed choices and decisions that fit their needs and circumstances best. And when supplementation is needed, parents can work with their baby's healthcare provider and lactation support to protect and build and maintain their milk supply through appropriate breast milk expression.
So the breast pump to collect breast milk to put in a bottle for feeding later, do you recommend bottle feeding and pacifiers, or are there any risks of using those?
So, generally, what we encourage families during the early days of breastfeeding, which is when baby's learning to breastfeed and mom is learning to breastfeed. And it is a learning process, and there can be some challenges during those first days and weeks, and generally say about 3 to 4 weeks of the baby learning to breastfeed. And while mom is establishing her milk supply and it's developing, it's recommended to delay use of artificial nipples or pacifiers until that is going well and it's well established. So that milk supply is plentiful and the baby is latching really well at the breast and it's going well. Now, Pacifier use can be protective for SIDS risk reduction. So generally we do have that conversation, but also we know breastfeeding is protective as well. So we do educate on, that pacifier use generally once breastfeeding is well established, parents may want to introduce that and have them use it at naps and bedtimes is what's recommended.
You mentioned latching. Is it common to have trouble with getting a newborn to latch properly?
So that is one of the most common things that we work with new parents on in the early days, and that can cause difficulties. So if a baby doesn't get latched properly, if they are not having a nice, deep, effective latch, it can cause some pain and can cause some nipple trauma or even, cracked or bleeding nipples, which obviously can cause pain and can be hard to attach the baby when you have that. So if there are any issues like that do come up, we work with families in the hospital, but then after, it's really important for families to know of the resources. There are resources of support. They can reach back at to the hospitals they delivered at. They can also reach back out to the Upstate Breastfeeding Medicine Clinic here at Upstate. We have a milk line that we use. It's 315-464 milk or 6455. That gets to our lactation team. And we also have support things that go on here at Upstate. We have Upstate Baby and Me and Upstate Breastfeeding Support Cafes where parents can come and get that support if they're hitting any of those challenges.
So it sounds like there are a lot of challenges or a variety of challenges. Is that why some moms end up not breastfeeding for as long as they intended to?
Yeah, so about 60% of moms in the US do not breastfeed for as long as they intended, with the most significant influence in that time is generally around, we say drop off occurs around 3 months postpartum. And what we attribute that to is lack of support is the main reason. So some moms go home, they have struggles, they may do well in the hospital, but then they go home and they may not reach back out if they have those struggles and may drop off or drop breastfeeding altogether. So we really encourage, breastfeeding is a learning process. And those challenges, there is support out there. And we encourage families to reach out, develop your support system early. And studies show breastfeeding support interventions really can help increase breastfeeding up to that 6 months of age. So we encourage families to reach out.
You mentioned the 3-month mark. That's about the time a lot of moms are going back to work. So I wonder, do moms who work outside the home have a harder time keeping up with breastfeeding than the moms who are home with their baby?
Yeah, it's good you mentioned that. So returning back to work after having a new baby can be very challenging for new parents, but poses special challenges for lactating parents. So returning to work can significantly impact breastfeeding continuation, and studies do show a drop in breastfeeding rates after returning to work to around 25%. Maintaining milk supply when going back to work can be tough, can be a challenge. You got to fit that in. A lactating parent needs to express milk every 3 to 4 hours when away from their baby. Their breasts fill up, they need to express. And that can be a challenge at work. So it can be a challenge for those going and working outside the home. Yes.
Are you aware of any policies that you've seen employers enact that can make a difference and improve breastfeeding rates?
Yes, so having strong workplace support can make a big difference for lactating employees trying to continue breastfeeding after returning to work. So we are really fortunate here in New York State. We're lucky to have progressive laws that are supportive of breastfeeding and new families. It requires employers to provide paid break time and a proper space for employees to express their breast milk. And having all these things in place can be really supportive and can be protective and helpful for new families. The other piece that's really helpful is longer maternity leaves can help families breastfeed for longer. And then having flexibility, like being able to adjust their hours if they want to go to part-time scheduling, that can make it much easier to help to continue with breastfeeding, especially since returning to work full time is also something that's linked with shorter breastfeeding duration.
As challenging as it is for a mom with one new baby, I can only imagine how much harder it is for moms of multiples. Are they able to breastfeed if they have twins or triplets?
Yes, the parents of multiples can successfully breastfeed, and doing so can offer important protective benefits. Because breast milk production works on a supply and demand system, so the more you remove, the more the body is stimulated to make milk. The body can increase output to meet the needs of more than one baby. Though some families may still require medical supplementation due to factors that come along with it, like exhaustion, limited time, energy, or prematurity of the baby, which is more likely in multiples, which can impact that. Now, we encourage early hand expression or pumping after feedings. That can really help boost milk supply for some. And during the hospital stay, nursing staff can help teach parents techniques that can help save them time, such as the double football hold. So, feeding two babies at once, one on each breast, can help save time and energy for new parents of multiples.
You talked a little about workplace policies that might be helpful, but what does a strong support system for a breastfeeding mom look like at her home? Who might be involved in that?
Oh gosh, so this I take like a broad approach with this. I feel it takes a village of support to provide that ongoing encouragement for a new family. And I believe it begins in the prenatal period. So that support should start in pregnancy or even before pregnancy and extend through that critical fourth trimester, we call it, which is the first 3 months after birth. And then continuing on through that first year or beyond. Um, and during pregnancy, support really looks like exploring prenatal breastfeeding, learning about breastfeeding, getting to childbirth classes, coming to our free Upstate Best Beginnings classes, which people can find at upstate.edu/bestbegin, to learn about those things and making informed decisions about infant feeding, but also everything surrounding birth, and just becoming familiar with postpartum resources where you can find those as well. And then after birth, helpful support may look like assistance with just the day-to-day tasks to help take some of that off of their plates, like chores, meals, meal prep, caring for the baby or other children while they can get a rest, and offering reassurance during challenges, like you can do this to get over any challenges that come up. And then encouraging the mom to seek help for any breastfeeding challenges that do arise or other infant feeding or postpartum concerns that may arise. So reaching out for that support. And then some key postpartum support resources that we have. I mentioned the Milk Line, 315-464-MILK, and our Upstate breastfeeding and baby and me support cafes as well. So really a strong village of support is really specific to that individual or family, but it may involve a whole team. We encourage you to build that team before they even, have that baby here. So it may involve spouses, partners, family, friends, doulas, nurses, lactation, community organizations like La Leche League, healthcare providers. So they're OBGYNs, midwives, pediatricians, office staff nurses. We have a lot of office staff nurses that are getting their certification in lactation to help support new families. The neonatal team and childcare providers also can be helpful. And those neighbors and friends can be a great support to families as well by helping support some of those things after birth. But really important stuff to help with that critical transition to new parenthood and life with a new baby.
It sounds like it. Well, thank you so much for making time for this interview. I appreciate it.
You're welcome. Thanks for having me.
My guest has been Nurse Cathy Narcavage-Bradley. She's a clinical outpatient health educator at Upstate. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith. thanking you for listening.